Hello, welcome to the Neuropathy Secret Summit. This is Dr. Brandt Gibson, and we're blessed with the opportunity to have Dr. David Phillips with us today. He is a Harvard-trained, world-renowned medical device inventor, educator, and author with 40 years experience in bioelectronic medicine. His books, Carving Your Own Destiny and How to Treat Neuropathy at Home, are on the bestsellers list on Amazon. Dr. Phillips received the Inventor of the Year award in 1987 for developing the first infrared ear thermometer. Some of his inventions include the GST breast cancer detection system, the ReBuilder for peripheral neuropathy, one of the reasons we brought him on here, the Veinplicity for enlarging the veins for easy vein access, Silver Cure, a cure for molluscum contagiosum, the Silver Pen for accelerated wound healing, and many others. Dr. Phillips is on the faculty of the American College of Physical Medicine and developed their board certification program for neuropathy and opioid addiction withdrawal. The other reason that we brought him on here is that he is a specialist in peripheral neuropathy and has information very valuable to you. Some of it is actually very, very new information. So we're excited to have you. Thanks for being here, Dr. Phillips. We're glad to have you.
Well, I'm glad to be here. If I can be of any help, then that's what I like to do. What kind of questions you got?
Well, the idea, let's start with, how did you get interested in your peripheral neuropathy?
Well, I got started in peripheral neuropathy because of the problem of my father. All the different inventions that I've made have been a result of a need in the family. So my father had coronary artery bypass surgery. And in that surgery, they used the vein from the leg, it's called a greater saphenous vein, as bypass material. When you lose a major vein in your leg, then you have less blood flow. So his muscles, left leg began to atrophy. He started to get pain, weakness, and numbness, and trouble walking. So I invented the ReBuilder, primarily got started to fix his problem.
Right. That's great. And you've worked with a lot of neuropathy over the years. So how would you describe peripheral neuropathy to our patients?
Well, peripheral neuropathy, you start with the word neuropathy. Neuropathy is problems with the nerves. Nerves is neuro, opathy means problem. So it's a problem in the nerves, and peripheral means the nerves that are in the extremities. Your fingers, your nose, your ears, your toes, and your feet. So it's a problem with your nerves, not in the chest, in the torso, or the head, but your extremities. So that's what peripheral neuropathy is. It generally presents initially, sometimes with tingling, a little bit of tingling in your fingers. You can't quite feel it. It's like being in a swimming pool or a hot tub or a bathtub, and you're in so long that you can't feel your fingers because they kind of get a little wrinkly.
Right.
From there, sometimes it goes to your feet, and you feel like you're walking on cardboard. After that, it starts to create burning and pain, even with the sheets at night, and can wake you up. From there, it gets to be very, very constant, and then can extend even into your fingers to where you can't touch anything because it hurts. So that's the way it generally presents, and can cause problems in your balance and things like that. And you can step on a nail and not know it and get an infection, and then you start to have amputations and lose your mobility.
So what are some of the treatment options that you found that help with peripheral neuropathy?
Well, some of the normal treatment options I can start with that don't work are the drugs. Lyrica, gabapentin, these are drugs that suppress the central nervous system. And so the signal that you're stepping on a nail or the pain doesn't get to the brain. Nothing else gets there either, however, and you create more and more numbness. It can also affect your sexual function, your memory, your clarity, your focus. So that's what generally is used. But there are other ways of treating neuropathy. Massage is one. Of course, the ReBuilder, which is what I have, we'll explain a little bit later. There's systems called the anodyne that have a red light that can stimulate the nerves at the extremities to vasodilate, which means open up and create a little bit more blood flow. But again, that's right at the skin. There are vibration machines that you can use. There's a machine you can buy on Amazon that causes your feet to wiggle back and forth, and that kind of smooths things out. But you really got to start with the cause. Something has caused it.
Right.
The causes can be a spinal impingement. In chiropractic terms, they call it a subluxation, but there's a pinching of the nerves in your spine. So the signal goes from your foot to your spine to your brain. So that's one cause. Other causes are things, drugs that we take for other purposes, such as statins. Your physician may have prescribed statins to reduce the cholesterol in your body, in your primarily your veins and arteries. So it does a good job at that, but once it cleans out the cholesterol, then it goes looking at other parts of your body for cholesterol. And part of the nerve, the axon part, is covered with a sheath, an insulating sheath. It's called a myelin sheath, and it's made of fatty tissue. So it starts stripping that off. And if you could imagine stripping off the wires in your car or your house, pretty soon you get shorts. So statins can cause that. You have to be very careful and follow your doctor's instructions, and sometimes you can get off of that. I don't like to be on it at all. I'd rather have a natural way of doing it. People who have been in Vietnam exposed to Agent Orange that attacks your nerves, that can cause it. Diabetes, even pre-diabetes, before you even know it. There are devices that your doctor can use to detect very, very small deficiencies, even before you are consciously aware of it. You happen to have caught me this morning. I'm in a doctor's office. We're seeing some tough patients. And the interesting thing is that I learned something last night when we were discussing things, a new technique for detecting the peripheral neuropathy, even before a patient knows it, and then being able to prove and demonstrate to the patient that they're getting better, whether you're using nutrition or massage or any of these electrical devices. Her name is Dr. Kim Martin. She's in Chicago. Where exactly are we here, Kim? Winnetka, Chicago. So why don't we take about 30 seconds and let her show you this little device. It's a thermographic device, temperature measuring device that she uses. And let me introduce her just for a second, because you should ask your doctor if he has one of these. And she should have one. If you are a doctor, you should get one. I don't sell them. I think she bought it on Amazon. You can buy anything on Amazon. So this is Dr. Kim Martin.
Great. So we get a 2-for-1 today. So we appreciate that.
Well, this is a surprise. Hi there.
Hi. Great to have you.
Thank you. So like Dr. Phillips said, my specialty, my niche here is neuropathy. And what I'm doing for my patients here is making sure that they do have an issue that I can help them with. Sometimes patients are so frustrated because they've been on different medications and they're not seeing fast results, and we have to be able to explain to them in a different manner, not like an MD would say, take this medication and come back in 90 days. So if I can't show a change in a short period of time, then they may not be a good fit for what I do. I also have neuropathy, so I know what needs to be done, and so I can tell when they're not doing their treatment. But the important thing is when they first come in, I don't have a 5-minute exam. My exams are a little bit longer, but what I'm doing is I'm looking for things that are deficient, that is not where they should be, as far as if I'm checking the O2 levels, I'm checking the temperature, I am checking different things like vibration, and I want to be able to go through and make sure that they're able to feel certain things, heat, cold, like I said, the vibration, the pinwheel. I want to know what is it they are able to feel in the beginning, and then if I do a mini treatment, what can they feel in the end? So I feel as chiropractors, we're always having to educate and then prove and then re-educate, reiterate. You know, I don't know why that happens that way, but that's kind of how it happens. And so we want to make sure that we are doing the best we can by making sure that we can show a difference. One of the things that I do in my exams is I have this, can you see this? So we can take a picture of the feet. Now, neuropathy can happen anywhere in the body, as you know. It can be in your hands, it can also be in your feet. But for the most part, we are talking hands and feet here. So if I'm going to be taking a picture, I'll take a picture in the beginning of their feet, and then it'll show the different diagram of the yellow, the red, the green, that type of thing. And then I'll finish the exam, and then I'll do a mini treatment, and then I want to go back to say, did I make a difference? This will be able to tell temperature, but it also will give you a visual of if there is a change there with the tips of the toes. Sometimes that's what it takes. Depending on where their damage is in the brain, they may not feel something for a while. So if you can show them a picture, you can show them it's not me just saying, hey, Mr. Patient, you're getting better. It's, this is the temperature when you came in. Then we did a mini treatment, and now this is the temperature when you leave. Or this is your oxygen. I've got patients that have been in 40, 50% with their toes in their oxygen levels, and you're wondering, you know, why they're having a problem walking, because they can't freaking feel the feet. And so when you're able to make that change in a short period of time, and I'm talking within a half an hour of having them go up to 70, 80% oxygen and having the temperature rise, then you know that you have a patient that understands that you know what you're talking about. But I don't know if you've seen this picture before, this camera. All I'm seeing is the there, but you take a picture of the feet, and then it'll show you the temperature in different areas of the foot, from the tip of the toes to the middle of the foot. And then you can also download this so that you have a before and after. And I always do comparisons left and right, you know, before and after with that. So this is one of the main things that I use. The other thing that I do is for a patient to really get better, if they are a good candidate, because I got to make sure they're a candidate for my type of treatment, is I make sure that they're doing home therapies as well as coming into the office. I don't know about you, but I don't want to see a patient 4 days a week. I think I want to see them 1 day a week and then have them do treatment at home. And that way you know that they're going to get quicker results by, you know, being part of their journey for health.
Yeah, the secret we're trying to help these patients understand is that they have to be involved. If they're not involved, they will not get better. And so that's kind of the idea. So this is a thermal scan camera, basically, right?
Yes, I got it on Amazon, and I don't know, what was it, like, hold on, let's see what it is. It's it was about, I don't know, $300 maybe, a little less than $300, and it will download all the information to your computer. So you just save it as whatever your patient's name is, and then making sure that you've got, you know, comparisons in that way.
Perfect.
Yeah.
So I appreciate so that the idea, really, patient, for all those that are listening, is Dr. Martin actually has just showed you the perfect exam you should be looking for. When you go to the doctor, you should be saying, okay, they should be not just taking a quick minute, oh, you have neuropathy, well, good luck, here's some things you can do. She's actually going through and examining all the pieces. She's going, okay, what's the temperature, what's the oxygen, how good is the blood flow here, how much sensation do you have, both the light touch and pain and temperature and all those kind of things, because the more you understand about your neuropathy, the more your doctor understands about your neuropathy, the better options you have as far as treatment is concerned.
Exactly. I will say this. The patients need to understand that it's 97% them and 3% you. So when you make that switch, so it's not the magic bullet, that they are part of their healing process. When they come into the office, I'm making sure that I use the ReBuilder. I also make sure that every patient goes home with a home unit of the ReBuilder, because they have got to be doing their treatment twice a day in order for them to see good results. Just think how long that would take if they came to your office only once a week. I'm asking them to do this 12 times before they see me the next time, as opposed to just doing it once a week. There's a long span in there. So have you seen this piece of equipment? Can you see
yes,
it?
we have. Yeah, that's awesome. And that's one of the ones that
This is the only thing that I use. Now, before he came up with this one, I was using the 2407, but I've been using his equipment for 10 years. And I would not be where I am today if I wasn't using this equipment.
Right. And you've seen amazing results.
Yes, on myself as well as my patients, definitely.
Great. Great.
Thank you so much for having me.
Appreciate your time. Thanks for the information, because that was very, very valuable, I think, for those that are attending the summit. So we appreciate it.
Okay, I'm back. So I know your next question is, what the dickens is a ReBuilder, and why does it work, and what does it do?
Right. She gave you a really good testimonial about how it works, that it does work. So what is it?
The ReBuilder is a device. This is the 24/7, a home unit. If you can see that, there you go, that you take home with you. There's two different types. Excuse me, but the purpose of the ReBuilder is to rebuild the nerves. And it sends a signal from one foot up the leg, to the knee, to the hip, to the lower back, or down to the other leg, the other knee, the other ankle, the other foot. And it does that, goes back and forth 7.83 times a second, and it wakes up and reconditions the nerves. The way nerves work, and this is kind of some new information that I discovered in my research, but the way nerves work is that they send a signal. They pick up a signal at one end, called the dendrite. They send that signal like you're feeling you're walking on a carpet. Sends a signal to the cell. The cell is like a brain, decides, oh, I stepped on a nail. That information needs to go to the brain. Or that's just carpet, I can ignore it. So it sends a signal on the other end of the nerve cell called an axon, and that goes through on touch. It doesn't touch, but it gets close to the next nerve. And there's a series of these nerves from your toe all the way up to the brain. It's just not one long nerve. So the way they connect is through a bubble of water called the synaptic junction. It's conductive, and this electrical signal jumps across from one side to the other, and it carries with it the information, and it carries the information like a waveform. If you were to look at the waveform of Frank Sinatra, I'm aging myself here, but Frank Sinatra singing the song My Way, one of my favorite songs, you look at the different waveform, and then if you and I were to sing My Way, the waveform has the same height, the same width. It looks very similar, but you and I don't make money singing. He did. So it has to be very specific. So when the ReBuilder first gets turned on, it reads the patients. It determines the size, the weight, the water density, things like that, and it sets itself for safety. So as opposed to other devices that you just turn on and it has no idea what is connected to, a dog or a cat or a grapefruit, this determines the safety, so you can't overdo it. Then it sends a signal from one foot to the other, and it waits. It gets quiet. So when the signal goes from one foot to the other, the one foot sends from the right to the left. That left foot says, whoa, I just felt a little tingle here. I better tell the brain something's going on. So it sends a signal to the brain. When it does that, the ReBuilder listens and picks up that signal, and it analyzes it kind of like a pacemaker of the heart, and it looks at it and it says, that signal's not quite right. So where it's low, it sends its next signal higher in that area. Where it's too strong a signal in that waveform, it sends a signal with a lower area. So it's like a Bose noise canceling headphone. It balances itself out. So it does this 7.83 times a second to give the nerve a chance to recover between each signal. The treatment lasts about 30 minutes. It's delivered through a set of foot baths that are separated. Warm water and electrolyte or even Epsom salts works. And you drop the electrodes in the water and you sit back and you turn it on. It feels like a massage, and in 30 minutes it shuts itself off. But in the meantime, for that 30 minutes, it's been very gently coaxing the nerves back to operating the way they were supposed to. And like any muscle re-education, although this is a nerve re-education, it takes time and repetition. So most people, however, when they're in pain, When they put their feet in the water, turn the thing on, the pain goes away instantaneously. For 30 minutes, they have no pain. Then for 3 or 4 hours, they have about 80% less pain. And then the next day they try it again. The pain level is a little bit lower than it was the day before, and it lasts a little longer. So they do it twice a day for about 2 weeks. Then they drop it down to once a day. Then they use it once or twice a week when they overdo things, and they kind of keep it aside for that purpose. So that's how the ReBuilder works. It's operated by a little 9-volt battery. It's very safe. You can drop it in the water and nothing happens. And we warrant these things for life. You're not going to get a toaster that's good for life. We've had patients run them over with their car and they send it to us in a little baggie, all these pieces. We just send them a new one. We want them to feel good. So basically that's what the ReBuilder does. And people can buy it online directly from us. We always recommend when they do that, we give them a name of 2 or 3 doctors locally that they can go to have what they call rule-out diagnoses. If they have a spinal problem, it kind of needs to be fixed. If they have diabetes, they need to get that under control. But 94% of the people who just buy it online at rebuildermedical.com, it's about $800, and it lasts your life, they get better. We have about 3% return it because it either didn't have neuropathy or they had something else, too much statins, or their diabetes, they're not willing to get it under control.
Right, perfect. So with the ReBuilder, you've got 2 different forms that they can actually do it at home, right? One is the water bath like you're talking about, also the electrodes. Is there an advantage to one or the other?
No, the electrodes you can place specifically. The water, warm water vasodilates the foot, the skin, so allows whatever arterial pressure is there to go through larger capillaries, and the capillaries are this side that opens them up so more blood flow can get into the calf, into the veins of the calf. It also, besides stimulating the nerves, it stimulates the nearby muscles. So
Right.
the venous muscle pump that pumps the blood back up towards the heart also gets exercised, pushes blood back up towards the heart. It strengthens the muscle for better balance. So it treats the nerves, the muscles, and the blood supply simultaneously. But now we have conductive foot socks. If the water gets it to be more trouble than it's worth, we have conductive gloves. We have a number of different accessories that the doctor can use or the patient can buy. I have a motorhome, and my wife likes to use it driving, but the water bath is kind of a problem, so she uses foot pads or conductive pads that are silver coated, and she just puts her foot on those while we're driving down the road. She treats herself that way.
Wow, that's great. So you're seeing amazing results. Dr. Martin actually talked about some of the results she's having personally and with her people. What are some of the results that you're hearing from around the country, around the world, I guess I should say?
Well, we have people who are in wheelchairs who get out of their wheelchairs. We have people who are almost suicidal. They say the pain is so bad I don't want to live anymore, and the pain can go away without the drugs and the side effects.
Right.
And they like that. Some of them are able to now. They've spent 40 or 50 years earning money to retire. They're now retired. Now they can't do anything. They're in a wheelchair, or they have to limp along, or they're afraid to go to a restaurant for fear that they might stumble on the next table and fall on it, so they don't go out. Now they can go out, they can live a normal life. There's no side effects, like I say. Their legs actually get stronger. We actually have athletes, particularly skiers, will use it before and after skiing. They'll use it before to warm up the muscles and get the extra blood supply. And then after they get done skiing and they're sitting there with a drink in their hand, and you find 4 or 5 people in a row, and they got their feet in these buckets, or they got these funny looking little gray socks on, and they're pushing the lactic acid, the buildup of muscle action from skiing, up and out of their system, so they don't have sore feet. They can go skiing again the next day like it's the first day of skiing.
Wow. So This is something they should be using when they go to Disneyland, right? At the end of Disneyland, they can.
Well, I don't know about that. I'm not much for exercise, frankly. To me, I'd just as soon take roller skates to go to the bathroom. But some athletes like to use it. They're football players that sprain their ankles, and they'll use it for physical therapy for that purpose. But primarily, it's for people who have numbness or tingling or pain in their fingers or their feet and their toes. And we always recommend that they go to their doctor to get a rule-out diagnosis, make sure that there's other things. To get the proper vitamin D, the vitamin E, vitamin C is very important. You've got to get out in the sun. With this crazy COVID stuff, everybody's locked up in their house. They're not getting sunlight. You create vitamin D on the skin by being in the sun. So you need to have enough vitamin C. If you get too much, you can get diarrhea. So sometimes it helps for the doctor. There's different types of vitamin C that can be prescribed. I know that's what you do, and you provide a complete service for them. And of course, you also do things for free, like what we're doing now on the web, which is really amazing. I really appreciate the work that you're doing. I've heard great results from some of your patients.
Great. I appreciate it. Are there any other secrets you want to share with the audience today?
Well, the one other secret is that although I'm an MD, I spent 10 years when I got a PhD in psychology. I thought, gee, that would be easy. I'd just sit in my chair and listen to people. So after about 3 months of them coming back for the same problems over and over and over, I learned hypnosis. Then I just hypnotized their butt and be done with it. So I use the hypnosis to invent these things. I get to put myself in a self-induced trance, and I say, okay, universe, so to speak, here's the issue. I don't know what the heck to do. You do. Give it to me. I got to go cut the grass. It usually comes to me in the shower, fully formed. So in this study of hypnosis, I've learned that a person's mental attitude has a lot to do with it. If they think that they're never going to get better, they don't get better. But if they get a little bit of hope, they can build on it, which is why what Dr. Martin showed me here with this imaging system, she can take an image and show that the toes don't even show up on the camera. And then she can treat them and then show them, take another image and say, oh, look at that, now you can see your toes. So that encourages the patient. So one other thing that I could add, besides the ReBuilder, is your mental attitude has to be proper. You have to be expecting to get better and have the hope to get better. So that's important.
Perfect. And I completely agree with that. We found even the use of some self-hypnosis to give you some of the abilities to manage the pain when you're in between things and stuff like that. So that's a great tool. But the hope is probably the secret weapon that most of us need to make sure we have for any health issues or any issues, because with hope, you can actually accomplish a lot more than you can without it.
Yeah, the book that you mentioned, Carving Your Own Reality, explains that mental part of it. When I was studying hypnosis, for instance, I could take a regular pencil with just a regular lead pencil, and I hypnotize somebody and I say, look, when I touch your finger, it's going to create a blister because it's very hot, but you won't feel it. And I have films of it, and a fluid-filled lesion would form. And then I would say, okay, now if I take the other end with the eraser and rub it on here, it's going to instantly make that better. And on the film, the fluid-filled blister gets reabsorbed. It's amazing what the brain can do. And many times we've heard that, well, when you get older, you're going to shuffle. You see older people and they shuffle and they're kind of leaning on things. So you say, well, that's a normal thing. I guess that's what I should do. So you don't have to do that. There are answers. Stop taking statins if you can. Take care of yourself. Get to a good physician. We found chiropractic physicians generally take the most amount of time, and they have vibration plates that they can use, devices that can kind of stretch out your back in case you have a pinched nerve, and they can do all those kinds of things. Then they can teach you how to use the ReBuilder. You can take it home and you can use it for as long as you want.
Perfect. So thanks for being here. This has been the Neuropathy Secret Summit. For those of you that are listening, if you say this was valuable information, and you can watch this as many times as you want over the next 24 hours. If you'd like to have it longer than that, we do have an all access pass, which for a minimal fee you can actually purchase, and you'll have this forever. So you can come back and listen to Dr. Phillips again and again, or listen to Dr. Martin even again and say, okay, what is she looking for? How is she examining people, so that when you go to your doctor, you can make sure you're examined that same way. And you also will have access to all the other individuals, as including audio of all this stuff, as well as transcripts. So you can actually go through and read it if that would be easier for you. Thanks again, Dr. Phillips, for being here. I love the ReBuilder. We're using it in my practice, and we're going to continue because it absolutely works.
Well, thank you very much. I appreciate what you do too. You have a good day, though.
You too.